Emotional distress is a complex and multifaceted phenomenon that affects individuals across various stages of life. It encompasses a range of negative emotional states, including anxiety, depression, anger, and frustration, often arising from challenging life circumstances or unresolved psychological issues. Understanding emotional distress is crucial for recognizing its impact on mental health, relationships, and overall quality of life. By exploring its causes, manifestations, and potential interventions, we can better equip ourselves and others to cope with and alleviate emotional distress. At its core, emotional distress is often a response to stressors that exceed an individual's capacity to cope. These stressors can be external, such as traumatic events, relationship breakdowns, job loss, or financial difficulties, or internal, such as unresolved past traumas or negative self-perceptions. When faced with overwhelming situations, individuals may experience a cascade of emotions that can lead to feelings of helplessness, despair, and confusion. This emotional upheaval can disrupt daily functioning and hinder one's ability to engage in meaningful activities, ultimately affecting mental and physical health. Anxiety is one of the most common forms of emotional distress, characterized by excessive worry, fear, and apprehension. Individuals experiencing anxiety may find it challenging to concentrate, sleep, or engage in social situations. This heightened state of alertness can lead to physical symptoms, such as increased heart rate, sweating, and muscle tension. Anxiety can stem from various sources, including work-related pressures, family conflicts, or health concerns. In some cases, it may develop into an anxiety disorder, requiring professional intervention to manage effectively. Depression is another prevalent form of emotional distress that can manifest in various ways. Individuals experiencing depression often report persistent feelings of sadness, hopelessness, and a lack of interest in activities they once enjoyed. This emotional state can lead to significant changes in appetite, sleep patterns, and energy levels. Depression can be triggered by a combination of genetic, biological, environmental, and psychological factors. It is essential to recognize that depression is not merely a temporary state of sadness. It is a serious mental health condition that can have profound effects on an individual's life if left untreated. The impact of emotional distress extends beyond the individual, often affecting relationships and social dynamics. When individuals are in a state of emotional turmoil, they may struggle to communicate effectively with others, leading to misunderstandings and conflicts. Loved ones may feel helpless or frustrated when trying to support someone experiencing emotional distress, which can create a cycle of isolation and further exacerbate the individual's feelings of loneliness. It is crucial for both individuals experiencing emotional distress and their support networks to foster open communication and understanding to navigate these challenging times. Furthermore, emotional distress can have significant implications for physical health. Research has shown that chronic emotional distress is linked to various physical health issues, including cardiovascular disease, weakened immune function, and gastrointestinal problems. The mind-body connection underscores the importance of addressing emotional well-being as part of a holistic approach to health. Individuals experiencing emotional distress may benefit from incorporating stress reduction techniques, such as mindfulness, meditation, or physical activity, into their daily routines to promote overall well-being. Addressing emotional distress requires a comprehensive approach that encompasses self-awareness, coping strategies, and professional support. Self-awareness is the first step in recognizing and understanding one's emotional state. Individuals should take time to reflect on their feelings, identifying triggers and patterns that contribute to emotional distress. Keeping a journal can be an effective tool for processing emotions and gaining insight into one's thoughts and behaviors. Coping strategies play a vital role in managing emotional distress. Healthy coping mechanisms, such as engaging in physical exercise, practicing mindfulness, or pursuing creative outlets, can provide individuals with constructive ways to process and express their emotions. On the other hand, unhealthy coping strategies, such as substance abuse, avoidance, or excessive rumination, can exacerbate emotional distress and lead to further complications. It is essential for individuals to identify and cultivate healthy coping strategies that resonate with them and promote emotional resilience. Professional support is often necessary for individuals experiencing significant emotional distress. Mental health professionals, such as therapists, counselors, or psychologists, can provide valuable guidance and support in navigating emotional challenges. Therapy can offer a safe space for individuals to explore their feelings, develop coping skills, and work through underlying issues contributing to emotional distress. Cognitive behavioral therapy, CBT, is particularly effective in addressing negative thought patterns and behaviors, empowering individuals to reframe their perspectives and develop healthier responses to stressors. Support groups can also be beneficial for individuals experiencing emotional distress, providing a sense of community and understanding. Sharing experiences with others who have faced similar challenges can foster connection and validation, helping individuals feel less isolated in their struggles. Support groups can offer practical advice, coping strategies, and encouragement, creating an environment where individuals can learn from one another and build resilience together. In addition to individual approaches, fostering a supportive environment within families, workplaces, and communities is essential for addressing emotional distress. Open communication, empathy, and understanding can create safe spaces for individuals to express their feelings and seek help. Organizations can implement mental health initiatives that promote awareness, reduce stigma, and provide resources for employees to prioritize their emotional well-being. In conclusion, emotional distress is a significant aspect of mental health that can impact individuals' lives in profound ways. Understanding the causes and manifestations of emotional distress is crucial for developing effective coping strategies and interventions. By fostering self-awareness, seeking professional support, and cultivating healthy coping mechanisms, individuals can navigate the challenges of emotional distress and work toward improved well-being. Additionally, creating supportive environments within families, workplaces, and communities can help individuals feel empowered to address their emotional challenges and promote a culture of understanding and compassion. Ultimately, prioritizing emotional well-being is essential for leading a fulfilling and balanced life, allowing individuals to thrive in the face of adversity.